Hey guys, thanks so much for joining me again. If you're new here, I'm Alicia. I'm a registered nurse. I just got my master's degree last year, and I'm on a mission to help empower you and help educate you to make informed decisions for you and your family regarding your healthcare. Welcome to Mommy's YouTube channel.
YouTube channel.
Thanks for coming. And get ready to learn.
Get ready to learn.
Alright, so nap time ended before I could finish recording my whole video, so we're going to see how long this lasts with Joshua. Can you say hi, Josh? Say hello.
Hello.
I hope if you watched my first two videos, you can see why more education needs to be out there regarding scientific research and evidence based on vaccines, not just on opinions alone. Okay, you gotta sit there and look, okay? If you have any questions on these two videos, drop a comment below. I promise to answer all of your questions. I really want to keep the conversation rolling. So also, when I was editing my herd immunity video, I didn't realize that my camera had died and I didn't get all of what I wanted to say on camera before I stopped filming. So I did want to mention that herd immunity is only relevant for communicable diseases such as measles and polio. It does nothing for you against diseases such as tetanus, which are found in the environment and are spread through bacteria. So think going to the park and you get scratched by, okay, you're bugging me, getting scratched by a nail, like a rusty nail on a park bench. So that's why the vaccines are important. Now, today I wanted to talk about one of the most infectious diseases that has been all over media lately, and that's the measles. So let's get into some of the background on it. Measles, aka rubeola, is one of the most highly infectious diseases out there and has an R0 of 12 to 18. And if you remember from my last video on herd immunity, the vaccination rate needs to be around 90 to 95% to protect the public with herd immunity. If just one person becomes infected, they can infect up to 90% of the people around them that don't have immunity. For a little history on the measles, before the measles vaccination program started in 1963, about an estimated 3 to 4 million people in the U.S. Contracted the disease alone, just the U.S. Of these, approximately only 500,000 cases were reported to the CDC, and of those cases, 400 to 500 people died. 48,000 were hospitalized, and about 1,000 developed encephalitis, which is brain swelling from the measles. From January to almost the end of May this year, there have been 940 reported cases of the measles. To put this in perspective, there were 55 cases in 2012, 188 in 2015, and 86 in 2016. So I've included a link that has great information on all of the years and why there was a rapid increase and then decline in the cases of the measles. But most of these cases seem to be related to travelers bringing it from overseas, which wouldn't be a problem if we have high rates of immunization. However, now we are seeing spikes in cases of infection because the rates of vaccination in the U.S. are dropping. Worldwide, we are still seeing 100,000 people dying each year from the measles, mostly in cases of children under the age of 5. Can you imagine what the death rates would start to look like if more and more people continue to vaccinate? According to the American Medical Association, there have been more cases of the measles in the first 5 months of 2019 than all of 1992, which was the last year that the U.S. experienced a major outbreak. The measles is spread through droplets in the air, for example, through sneezes and coughs. And because the measles is so highly infectious, if one infected individual is in a room with 100 other people, and all 100 of those people are not immunized or have no immunity, around 90%, so 90 of them will become infected with the measles. The measles is spread through droplets in the air, for example, through coughs and sneezes. And because it is so highly infectious, just one person that is infected with the disease can walk into a room of 100 people who don't have immunity, and around 90% or 90 of them will become infected with the disease. This can occur when someone starts to show signs and symptoms of the infection, and then they seek treatment either through their healthcare provider or going to the emergency room, and then now they are exposing everybody along their way, especially people that live in major cities that use public transportation. Think about all the people that you come into contact with in and out of the bus or the train. The incubation period for the measles is 7 to 14 days, which means you will come into contact with the measles long before you start to show signs or symptoms. After the incubation period, people typically develop symptoms that aren't really indicative of the measles virus, so they'll have maybe red eyes, cough, runny nose, and then they'll start to develop the rash, and it starts in red bumps, like red blotches on the face, and then it'll spread down the arms and into the trunk. And then the last sign is a very high fever, typically you're considered contagious for 8 days, and that includes the 4 days before the rash even starts to occur. So if you think that you have come into contact with the measles virus, there's a few things that you could do. The first thing is to contact your healthcare provider if you're unsure if you are immune. Call them immediately. Do not go into the clinic until you've spoken with the clinic, because you can potentially infect tons of little kids, pregnant moms, the immunocompromised, etc. There's no specific treatment for the measles. However, they typically manage the disease by controlling the symptoms it causes. Fever reducers are given, antibiotics if bacterial infections occur because of the infection, and pregnant women and infants and the immunosuppressed might receive the immune serum globulin to help with their symptoms. Some of the complications of the measles infection include bacterial ear infections resulting in permanent hearing loss. It can lead to intellectual disability. Kids can also develop croup, severe bacterial pneumonia, encephalitis, and encephalitis in 1 in 1,000 children can lead to permanent hearing loss, intellectual disability. And for pregnant women, it can lead to preterm labor, low birth weight, maternal death. 1 to 3 in 1,000 children that become infected will die from respiratory or neurological complications. It is so important to vaccinate because there is no way to determine who will develop these complications, who will just have an ear infection or who will have permanent intellectual disability or die or death. About 1 in 5 people in the U.S. who develop the measles get hospitalized. That's 20%. So one thing that I do want to talk about really quick, because it's something that I hear a lot, is if we see only so little number of cases of the measles, why is it so important to vaccinate? Well, we see so little because we've had vaccination efforts for the past 40 years. I can't do 60 years. I can't do the math that fast in my head. But people have been getting vaccinated, and we have been preventing the disease. It should be eradicated. However, now that people are choosing, and that's why we had so little cases. But now that people are choosing not to vaccinate, that's why we're seeing a rise in cases. Although it doesn't seem like a lot, that number will continue to grow as our herd immunity and our immunization percentages and numbers lower. So what's the best way to prevent the measles? The MMR vaccine. If you've already had the illness, then you have natural immunity. And 1 dose of the MMR vaccine is about 93% effective, and 2 doses are about 97% effective in preventing the disease. The first dose of the vaccine is given between 12 to 15 months, and then the second dose is given about 4 to 6 years of life, or typically before they enter kindergarten. This vaccine is typically given a little bit later in life because some natural immunity is passed through the mom to the baby, which is why they don't need to get it until about a year of life. Keep in mind, if you're going to be traveling abroad with your child that's about 6 to 11 months old, talk to your doctor about getting the first dose of the vaccine earlier. And if your child didn't get the 2 doses at the recommended times, he or she may need 2 doses of the vaccine 4 weeks apart. So I'm not going to go in depth on the populations that are immune, so please see the CDC website. I've linked it below, and you could determine if you need, if you are immune. But how do you know if you need the booster? So if you were born before 1957, more than likely you have come into contact with the measles, and therefore you have natural immunity. If you're born from the years 57 to 1989, it's more than likely that you received 1 dose of the MMR, and about 92% of those people will be immune mostly for life. If you're born 89 or later, that's when they started the 2 doses of the MMR, and it bumped the immunity chances to 97%. If you're not sure if you need the booster or if you need the labs to be drawn to determine immunity, just contact your physician, especially if you're traveling abroad. So with any vaccine, any medication, there is a risk of a reaction, and with the vaccines it's mostly very minimal side effects. So that includes injection site pain or tenderness, fever, redness or rash at the injection site, maybe a little swelling, or swelling in your glands in the cheeks or the neck. Typically these are mild and are not of concern, although they are annoying and uncomfortable for the person dealing with them. In cases where there's a more serious reaction, please report them to the Vaccine Adverse Event Reporting System, and I've included a link to that below as well. These side effects, like I said, are very, very uncommon, and they can include a seizure, but that's often associated with a fever left untreated, temporary pain and stiffness in the joints. This is mostly in teenage and adult women. A temporary low platelet count, which can cause unusual bleeding or bruising, or a rash all over the body. Now, I won't go into too much on the MMR vaccine and autism today because I have a whole video planned discussing the links, or lack thereof, of vaccines and autism. To date, there is still no scientific evidence to determine a link between the two. The Journal of American Medical Association, the World Health Organization, the Center for Disease Control, the Institute for Medicine, and many other organizations all agree, based on the research, there is no evidence for a connection between autism and vaccines, especially the MMR. I now have a call to action for all physicians, especially pediatricians and my fellow nurses. There's an ever-growing distrust of the healthcare world, especially when it comes to vaccines. I know we're all extremely busy, but please take the time to sit and listen to your patients or your patients' parents, especially when they have concerns and fears surrounding vaccines. If they are scared and nervous when it comes to vaccinating their family, please try to understand where their fears are coming from and truly listen to what they are saying. We have the ability to positively impact the decisions of our patients and their families, and all it takes is a little compassion. When you show care and concern, they are going to be more likely to hear the facts regarding vaccines instead of turning to social media and other channels for information. So I'll probably end it here. I know that was a lot of information, a lot of numbers, and you're a trooper for sticking through it. With continued vaccination efforts and work to increase scientific education, hopefully we can improve our herd immunity. Come back and join me next week to talk about the delayed vaccine schedule. I have gotten so many questions on that and requests for video information on the delayed schedule, so stay tuned. I'll include all of my resources below so you can check them out. I didn't make it all up. If you liked the last few videos, please hit like and subscribe and share with any friends or family that are concerned about vaccinating or are just looking for some more information. Thanks so much, like I said, for joining me. I hope to see you guys next time, and have a great day.